Headaches, where do they come from and how to relieve them? Thousands of people regularly suffer from headaches or headaches. Between half and three-quarters of adults aged 18 to 65 worldwide have experienced this symptom in the past year. More or less intense, of variable duration, these pains can be very debilitating on a daily basis. Definition: tension headache, migraine, pain. A headache refers to pain felt in the cranial box. In the majority of cases, these are so-called primary headaches. They include migraines, tension headaches and cluster headaches. Tension headaches are the most common in the population and the least painful, explains Professor Andreas Kleinschmidt, specialist in neurology. Migraines, on the other hand, can really affect the quality of life. This type of headache is circumstantial. It is most often caused by physical exertion, a stressful situation, fatigue, muscle tension, etc. Secondary headaches can be the result of benign sinusitis, viral infection or more serious high blood pressure, brain tumor dysfunctions. Moreover, according to the French Society for the Study of Migraines and Headaches, 20% of migraine attacks are accompanied by an aura. An aura refers to the neurological symptoms, most often visual, that precede the headache. Symptoms: pain, nausea, blurred vision. The exact location of the pain, its duration and other accompanying signs vary depending on the nature of the headache. Nausea and blurred vision may appear when the pain is intense. Tension headaches are the most common. They cause pain around the head, the feeling of being caught in a vice, which sometimes radiates into the neck. Migraine is recurrent and manifests itself in attacks. It causes unilateral, throbbing pain like a throbbing, always in the same area, which intensifies with physical activity. It can last from a few hours to several days. The auras that sometimes appear before the migraine attack can be visual spots in front of the eyes, blurred vision, etc., sensitive tingling in the arm or mouth or a phasic, language disorders. These symptoms usually go away when the headache sets in. Cluster headache, which is rarer, is manifested by attacks of very intense, throbbing pain, localized on one side of the face, usually around the eye and the temple, but also in the teeth, ear and neck. The pain is often accompanied by watery eyes and a stuffy nose on the affected side. Causes: stress, hypertension, medication. Many disorders can promote the onset of headaches: a dental problem, lack of sleep, an end infection, stress, undetected or uncorrected vision problems, certain medications, high blood pressure, hormonal fluctuations, premenstrual syndrome, etc. Chronic overuse of headache medications may also be involved. For migraine, experts speak of a genetic predisposition, so some people are more prone to it than others. Over time, patients suffering from migraine learn to recognize the factors that trigger its onset, adds Professor Kleinschmidt. This can be stress, particular foods, chocolate, alcohol, cheese, etc., lack of sleep, etc. It's all unique to each individual. Headaches associated with sudden and intense pain may suggest subarachnoid hemorrhage, meningitis or ruptured vascular aneurysm. Headaches associated with progressively onset pain may evoke Horton's disease. This is an inflammatory arteritis, in other words an inflammation of the walls of the arteries, the temporal arteries in particular, which most often occurs in old people. They can also be a sign of a brain tumor, or a cerebral hematoma occurring after a head trauma.